I'm Dr. Emily Gibson from the Student Health Center at Western Washington University, and I wanted to take a few minutes to talk about suicide prevention on our campus. As a college health professional here at Western for the past 22 years, I'm well aware that suicide is second only to accidents as a reason for untimely and tragic death in our student population. We know that depressive symptoms can sometimes include disturbing suicidal feelings and can be one of the most potentially lethal and yet, hopefully, one of the most treatable conditions that we see in our clinic on a daily basis. With the help of the professionals at the counseling center on campus, we can make a difference for anyone who is struggling with whether or not to live. We know it can be extraordinarily difficult for students to talk about their suicidal feelings, but we know from years of experience supporting students through these tough times that it is temporary and it responds well to treatment. What are some of the warning signs? You can't always tell when a friend is considering suicide. Some people talk pretty openly about suicide, and other times there may be only subtle signs or no signs at all. Some of the more common signs might be talking about suicide, including making remarks such as, "I just don't want to feel this pain anymore," or "I wish I were dead," or "I wish I hadn't ever been born." Sometimes they start to isolate more, wanting to be left alone. Sometimes they have dramatic mood swings, such as feeling emotionally high one day and then very deeply discouraged the next. Maybe feeling preoccupied with death or dying or violence. They might be feeling like life is out of control or that they're trapped or hopeless about a situation. They might be self-medicating with alcohol or drugs. They might be changing their normal routine, including their eating patterns or their sleeping patterns. They could be doing risky or self-destructive things such as abusing drugs or driving recklessly. They might start giving away belongings or getting their affairs in order. They might be saying goodbye to people as if it was the last time they might see them. So approach the person you're concerned about and say what you've observed. For example, "You stay to yourself a lot more than you did last quarter. We miss seeing you, and I'm really concerned about you." Or you might say, "It's not like you to sleep through your classes. You used to love your classes and your major, but now you seem not to be caring about your classes or anything else. What's going on?" Or you might say, "When you talk about your life, you sound like things are really hopeless. I'm concerned that you might be getting depressed. Can we talk about how we can help you?" Ask directly whether the person you're concerned about is thinking about suicide. Your bringing it up does not cause someone to think about suicide for the first time if they haven't thought about it before. Some ways to phrase your questions could be, "Are you thinking about suicide? Are you thinking about dying? Or do you think about hurting yourself? Or have you tried? Have you thought about how you would do it? Do you have the means to hurt yourself? Weapons or pills? Do you think about when you might do it?" Get help if you're concerned about somebody. If your friend tells you about his or her suicidal thoughts, listen with compassion and without judgment. Repeat your concern to them and offer that you could go to an appointment with a counselor or a healthcare professional with them or help them make the appointment. Talk with them about what's available on campus. The Counseling Center and the Student Health Center are free services to enrolled students and also offer after-hours consultation by phone for free. Encourage the person to avoid alcohol and drug use, as these can increase impulsivity, increase depression, and increase the risk of them harming themselves. Remove potentially dangerous items from their environment, including pills and weapons. Never promise that you will keep someone's suicidal thoughts a secret. If you believe a person is at risk of suicide, please talk with a counselor at the Student Health Center or at the Counseling Center on campus, your RA or your RD, or a healthcare professional on campus. Suicide prevention deserves our focus and our energy. We can save lives every day through compassionate listening and by taking action. Please let us help. We know how.